this morning. Really excited to be working together. And Ron, thank you for reaching out. I'm glad we could put this together quickly. In the regional offices, we do quite a bit on a whole sorts of different issues that we're involved with, but really it's our experts in DC that really help us drive the discussion. So excited this morning to have Marc and Katie on to talk about two very important issues to us, that being the PRO Act, and then of course, healthcare policy, something that Katie and I work very closely on. I don't want to take up too much time. I know they have presentations prepared. So Katie, I think we'll start with you. If you're ready to roll.
Great. Yes, I am. Sorry. Thank you so much. It's nice to see you all today. My mother's from Michigan, so always have a fond spot in my heart for Birmingham, Michigan and the Wayne area. Nice to see you all. I thought I would start with a deck, so I'll start by sharing my screen here. Let's see. Okay, can you see my screen?
Yep.
Okay, excellent. So I wanted to talk with you all a little bit about a campaign that we launched last summer called the Chambers Pact, Protecting Americans' Coverage Together. And it's our campaign that was intended to do sort of three things. Number one, talk about the strength of the employer-sponsored system. Number two, push back on Medicare for all, Medicare buy-in, a single payer, public option, sort of the whole host of flavors that are being put forth by the Democrats to expand government's role in health insurance. And number three, to talk about what can be done to address costs from the private sector. So to kind of tee this up a little bit, I thought it would be helpful to walk through why this Chamber Pact is so important and explain to you all sort of what we see the concerns in Washington being, both from the left and the right, as well as concerns in terms of our some of the business perspectives on public option and growing interest there. And we'd love to also kind of showcase opportunities for chambers like the Wayne County Chamber to speak about the importance of the employer-sponsored system and push back on Medicare buy-in. So I appreciate the opportunity to talk with you today. One of the things that's been really concerning over the past year and a half or so has been growing interest among some of our normal colleagues and supporters in DC and around the country. We've heard from a number of different trade associations. I tend to refer to them as benefit trade associations. They often purport to stand as employers in healthcare and retirement issues, but their members tend to be chief HR officers, and it's been really alarming to hear from those organizations and their members about intrigue and interest in the public option and single payer, and more alarmingly in Medicare buy-in, Medicare expansion. So there have been some really alarming polls that show 64% support a public option, 65% support a Medicare buy-in, and those numbers increasingly are trending in the wrong direction. This is something that's happening at the federal level as well as at the state level. Jayapal and Dingell in March introduced a Medicare for All Act with 100 Democratic co-sponsors, and we're also seeing this pop up in the states. One of the things that's been surprising over the past, I would say, 8 years or so also has been conservatives and their push to decouple health insurance from employment. This was something that we heard Paul Ryan talk about a few years ago in terms of trying to push for a healthcare backpack, more portable insurance, which sounds terrific as an option, but I think we are increasingly concerned about pressure that it's putting on the 180 million Americans that have insurance through their employer and value that. It's the most favorite part of compensation that we understand employees have in terms of their package, and it's something that we think is really important to protect. It's also something that the left continues to push as a solution to the challenge with the uninsured. And at this particular time during COVID, with so many people losing their jobs and with it employer-sponsored insurance, it's increasingly worrisome, which is one of the reasons the Chamber strongly supported the COBRA subsidies in the American Rescue Act. And we're very pleased to see that those subsidies are going to be available to help individuals that have lost their jobs involuntarily and allow them to continue their employer-sponsored insurance through COBRA. What we're hoping to do is really galvanize the business community around the employer-sponsored system and talk about the value and the benefits that employers and employees see with this system, both in terms of recruitment and retention, but also in terms of really driving greater health and being able to target plans and coverage to address the concerns of their employees. So this was a campaign that we started back in August, and it was something that we kicked off with Alex Brill, who is an economist and health policy expert, to talk about the impact on the economy. We are concerned about increasing cost shifting, and so looking at the fact that in many communities, hospitals are sort of the significant employer in a particular community, and as those hospitals see decrease in reimbursement, kind of what the trickle-down effect is going to be in terms of employment and community economic growth and stability. Our hope is to establish and reinforce the business case and push back on government-controlled healthcare, elevate corporate leaders, including at the state and local chamber level, and really trying to drive national thought leadership and advocacy on this issue. We have a number of different elements to the Chamber Pact, content, as well as education and amplification on the Hill. It's really a very fulsome campaign, and one that we're focused on reaching C-suite allies. I think one of the things that we hypothesized and has been sort of tacitly recognized is that for these benefit trade associations that are hearing from chief HR officers, those chief HR officers are not necessarily speaking for their CEO, they're not necessarily speaking for their company, they're speaking likely personally. And those chief HR officers are often evaluated and compensated based on their ability to meet certain metrics, many of which may be controlling premiums. And so one of the things that we had theorized and has been, again, privately recognized is that as CHROs are evaluating opportunities to control healthcare costs and premiums, they're sort of thinking, gee, if my older workers have the option of buying into Medicare, perhaps that's going to help me control my premiums. Perhaps my older and sicker workers will select that option and my risk pool will improve. And one of the things that we believe, and we're working through PACT to kind of establish, is that it's likely really the healthier older workers are going to elect a Medicare buy-in, leaving the employer with actually a worse off risk pool, number one, and number two, increased cost sharing and cross-subsidization being required as additional individuals are put into a program that reimburses pennies on the dollar. So our efforts are, again, really threefold in terms of trying to highlight the value and the importance of the employer-sponsored system, to pushing back on the detriment that a single-payer Medicare buy-in, public option, whole kind of litany of proposals that are out there would have on the employer-sponsored system, and then really talking about the great efforts that employers already are exploring and advancing to control healthcare costs, whether that's direct contracting, whether that's working through centers of excellence, whether that's value-based insurance design. Those are really, I think, where we are pointing to in terms of opportunities to control costs. And this is something that, you know, we're really trying to take an expansive discussion on in terms of talking about workers, in terms of talking about taxpayers, healthcare providers. One of the things that is really critical from our perspective is to make the business case. There are certainly efforts that we support and are watching from the industry, whether it's hospitals, payers, et cetera, that are making these same points, but we think it's really, really critical for the business community to be the one to also make those points. So as to really focus on the importance of employer-sponsored insurance and not just the importance of reimbursing providers appropriately. And so this has been something that we launched back in August. We had an event that featured NRF as well as the Chamber and Alex Brill in terms of talking about the importance of the employer-sponsored system and the opportunities for strengthening it. And we continue to have a number of different posts and articles. One came out in correlation with the launch of Jayapal's bill earlier this past month, and we continue to really bang the drum on this. We would love to have state and local chambers join us in this effort, as well as other companies. And I've already heard from a number of our different member companies that are planning to stand lockstep with us and try to advance examples of their successes. With that, I will stop and see if folks have any questions. And I will stop sharing my screen and take any questions.
Great. I know I'm almost certain there's going to be several questions because I've had discussions with a couple of our public policy committee members about this legislation or proposed legislation. And so I do want to, at this time, as Katie mentioned, we do want to open it up to the committee.
Ron, I'll jump in with the first question here as people kind of think about others. Katie, there's talk about various types of, so we have Medicare for all, you mentioned Medicare buy-in. Can you maybe give us a quick kind of overview of the various types of proposals that are out there and getting the government more involved in health insurance and how those may differ or how they are similar and how they'd impact, the business community?
Sure. I think our perspective is there are sort of a variety of different flavors, if you will, in terms of Medicare for All being a government program that anyone could elect, Care buy-in, which would lower the eligibility age and allow for individuals, say 55 and older, to buy into Medicare. And then there's also the public option opportunity, which is something that was discussed back during the Affordable Care Act, where there would be a government insurance option available on the exchange. And I think from our perspective, while they have different elements to them in terms of who could potentially take advantage of those new programs, we really see the threat as being a bit of a slippery slope. And so are very concerned about, number one, poor reimbursement amounts and the impact that will have on ecosystems around the country in terms of communities and their economies, as well as disrupting the opportunity for individuals to get more tailored benefits through their employer.
Well, I'll go ahead and I don't know if this is more of a comment, but I'd like your take on it. So I don't know where I've heard or read this, but I've seen somewhere that the ultimate goal of the left is to have complete government health care plan, and that the option for Medicare for all or some sort of variation of that is really ultimately meant to squeeze the private insurances out of business. When you've got a cheaper option that's supported by government payments or our taxes, that the insurance companies won't be able to compete with that and won't be able to price it the same as they will be, and that we will end up with a government system, period. And that should scare the bejeebies out of everyone if you had any experience with Obamacare and all the promises they had on how that was going to lower prices, and in some cases they doubled, and that you're going to be able to keep your own doctor. And none of the promises of that happened. And I don't want to say that's typical of government, but there's no one to blame when it's government. At least if you have an insurance company, people complain that you're in a bureaucracy in these big insurance companies, and sometimes you're hitting your head against the wall. But ultimately, the employer can change companies. There is, some alternatives. Where do you go to if all you have is government?
Yeah.
So do you agree with those comments, or tell me where I'm wrong?
I agree with you. And I think one example that perhaps folks are seeing, I've got 3 middle school children and different attention issues. And, I think for the folks that have experience with the mental health system, even when you have private insurance, it's very difficult to find a mental health provider that takes health insurance, because they can get reimbursement and out-of-pocket payments from individuals that are desperate to see them. And I think we need to only look to that to see sort of what the detriment could be if we move forward with additional government involvement. I think we'll probably see a 2-tiered system where people that can afford to pay for out-of-network or providers that do not receive health, the public option will do so, and others will be stuck with a limited supply of providers that are difficult to get in to see.
I do want to kind of chime in here for a minute. Thank you, Dennis and Katie. One of the strengths behind our public policy committee is the diversity of industry that's represented. So we do have a really, a great, again, range of opinions and experience. And with us is Louis Pisker, who is the CEO of Wayne Metro Community Action Agency. And we're talking about, I think, a lot of, this proposed legislation really impacts their work and the impact that they have on our community. So Louis, I hate to put you on the spot, but I would love to hear, some of your thoughts and feedback on this topic.
Well, no, Ron, you're not putting me on the spot at all. No. I hear the different points of view. We just come at it from just a totally different angle. I mean, if we see people that are like low to moderate income, and even the clients that we see or that are in our care that do have health insurance, you're paying more for the co-pays and the deductibles on a private plan that you are for the actual cover before you can even get to the coverage. And for us, we see like a great value to low to moderate income people that are working or working poor, that do have a sense of coverage on a Medicaid for all plan. And we see some really advantages to economic mobility with those plans, and so we just take maybe a little bit of a different take on it, because the plans provide coverages for people that could not otherwise afford those high deductibles and co-pays before you can even get to the coverage itself by the private employer.
I wonder a little bit about how the American Rescue Plan increased subsidies in the Affordable Care Act will impact that population. There were some pretty significant changes made on a temporary basis to remove the subsidy cliff, as it's referred to, which is the 400% of FPL cap on who can receive premium tax credits. And it also, the act also included the addition of an 8.5% threshold. So individuals should not be paying more than 8.5% of their household income for coverage. And so, I wonder if there are, while those were proposals that the chamber didn't take a position on, it strikes me that those individuals could potentially be assisted through a more private form of assistance than a Medicaid for all. And I guess the other point that we often make and think about is when you look at Medicare, 9 out of 10 Medicare beneficiaries have an additional type of coverage, whether it's Medicare Advantage, whether it's a supplement. And so Medicare in and of itself is really not sufficient in terms of if you look at who is eligible for Medicare and who buys additional coverage to support their health needs. And so I wonder about how robust and comprehensive a public option will be. And the dial on that is the cost and the tax amounts in terms of how are they going to pay for it. If it's a very robust plan, they're going to have to, find funding for it. And if it's not, then it's no better than perhaps where we are.
Well, we'll see. I guess we'll see, and we'll wait and see what that legislation and what those particulars are. And I guess, the only, it's not because I have private health care. I mean, it's just what I hear from people is private health care is like sometimes private health care for profit. And as a user of how do you get around the user of the system? You're being restricted to access to health care, in more of an HMO type setting, that maybe the final cost is not giving you maybe necessarily the best care through a referral process, but it's to keep healthcare costs down. I mean, I know that's probably good for maybe me as an employer, but it might not be good for the staff that I'm employing that can't get necessarily maybe the healthcare they need, or they can't get the referral, the accessibility to healthcare that they need. And so, when you look at maybe a government plan, does it give you or more vast options to go see that specialist you might need? Those are just, some of the things that, that we see with just the low cost healthcare that a lot of employers provide. I'm not an expert in this in any way. These are just some of the things that we see at Wayne Metro that maybe I can put forth for discussion this morning.
I appreciate it. Thank you. And I guess some of it is perhaps philosophical in terms of who you trust and whether individuals feel more likely that the government will help them or more likely that private companies will help them, and where are you more likely to get access versus restrictions. And I think, the balloon is always, premiums and copays and coinsurance and other things that pay for the benefits that you receive. And then how do you balance that with access, both to the benefits, but access in terms of affordable premiums and coinsurance. And it's certainly tricky.
So Katie, I want to ask a couple of questions just to clarify the current status of the proposal. Where does the proposal stand? Is it legislation that's in a committee? And then the second question to that is, I think a lot of people are concerned about what would this potential, bill look like? Does that mean that private insurance is going to be completely eliminated? What happens to private insurance companies? Those kinds of things. Could you speak to those?
Sure. So Jayapal introduced a Medicare for All proposal this spring in March, and there were about 100 different Democratic co-sponsors on it, more than half of the House Democratic Caucus, including 14 committee chairs and key leadership. We expect that it's not going to go anywhere because it's that there's such divided government, and we don't see Medicare for All as a threat at this particular time. I think it's more of a flag in the sand, if you will. I think our focus and our concern is really on more moderate elements of that type of proposal, which would be something that I think proponents would say it's just another option. It wouldn't eliminate private insurance. It's just more choice. And I think to Dennis's point, more choice is in the eye of the beholder in terms of how that crowds out other coverage and what that means. So it's been referred to different committees. I don't know that we'll necessarily see movement on the Medicare for All proposal, but it's certainly a growing element of the Democratic Party.
Great, thank you, Katie. And I'm looking at the clock and I see we're kind of running out of time, so we do have to move on to the next topic. But are there any other quick comments or questions? And Chris Mattis, get ready, because I am going to ask on the next topic with the PRO Act. I am going to ask you if you can provide some insight from Senator Peters' office on his thoughts. So you're on deck. But any other thoughts or questions?
Just, I want to make a quick comment, Ron, in that I'm on the board of the hospital, and my second question was going to be kind of to address what Lewis was talking about. Was, so if you got a great job and good or decent insurance, you're in great shape. But what about the people, their employers don't have coverage, or they don't have a job, and those type? And I know we have government programs, but I've seen them work, and I've seen them not work. To some extent, we're bearing the cost of that. The hospitals had a huge write-off every year of people that can't pay their bills. And all the private insurance employers are paying for that because, that's built into, and the cost of providing health care that's spread across all the people who are covered. And I just want to alert people, there's a cost to that. And I don't have any answers, but and I don't think government should be running it, because I've seen how that doesn't work. But there's a cost to these people of not having coverage, and not having adequate coverage, or not being able to get coverage. And that ends up at the bottom line of the hospital, income statements, where there's huge write-offs of these people that can't pay. So just another slant on the issue there.
I was going to ask if Jeffrey from Beaumont was here, if he could speak to that. I don't see him online here.
No.
Yeah, unfortunately, Jeffrey and also Anne Marie Caridi usually joins us from Henry Ford Health System. They both couldn't make it this morning, unfortunately, but we can definitely follow up with them in the next committee meeting.
But we're bearing the cost of that, so it's a cost that you don't see because it's not in the tax system, but there is a cost to that we're bearing.
Great. Kevin, I saw you unmuted yourself. Did you want to add anything?
Well, nothing on this issue, Ron. I think this is a good place to pivot. We were talking about the status of some of the healthcare proposals. Katie mentioned they're in committee. I wanted to kind of pivot to our next topic, where we are seeing movement. Well, a bill that has passed the House, the PRO Act, and you specifically asked to hear about a little bit more on this issue. I think specifically because it's been bubbling up and then passed the House and talked about, would make significant changes in our workplace policy. So very pleased and grateful to have Marc Freedman, Vice President of Workplace Policy, join us from the U.S. Chamber to cover some of the details of what's in the PRO Act and where it stands. So Marc, you want to take over the screen share?
Thank you so much, Kevin. Good morning, all. Thank you, Ron. Happy to be with you all. Like Katie, I have some slides I'd like to use, so bear with me a moment while I load them up. I hope I can do that. All right, that looks like a good start. What's happening here? Okay, so I suspect by now most of you have heard about the PRO Act in some broad sense, and I want to sort of dive into some of the details here to get a feeling for why we take the position we take on it. And I am interested in hearing from Senator Peters' person later on, and maybe we'll have an interesting dialogue. Just sort of basis atmospherics. It's all about giving unions more opportunity to organize. Here are some basic numbers. The sponsorship and the commitment by Senator Schumer made recently in an article that he said if the bill gets 50 sponsors in the Senate, he will commit to bringing it up. That was without reference to the filibuster question, but I think he feels that if he gets 50 co-sponsors, he's on his way. Just a quick note about the House vote. We had 1 Democrat vote against it and 5 Republicans vote for it. And you know, this shouldn't surprise anybody. This is what's driving the desire for the PRO Act. The significant drop off in union membership levels. And if you note the private sector number there, and you notice the difference between private sector and the overall number, as has been noted in many places, much of what is driving union membership these days is in the public sector, particularly in the state and local government levels. And so in the private sector, the unions have really lost a lot of membership. So let's get into some of the key provisions of this bill. I think some of you may remember the fight around the Employee Free Choice Act, EFCA, which focused on the whole question of the private ballots and the card check concept. This is a picture of an actual card, which the representatives get employees to sign to authorize the election. Under the PRO Act, they've made a couple little changes, but the bottom line is a union is not going to allow the voters, the employees, to have the final say. If the union loses, they will have the opportunity to raise charges of employer interference, and if those charges are agreed to by the NLRB, and right now we're going to have a Democrat-controlled NLRB, then the selection process would proceed by a card check. I think as many of you may recall, the card check process tends to be very coercive. Union representatives can approach employees anywhere they can find them, and they will often use lots of different pressure tactics to get them to sign these cards. The other thing that this bill does is it expands what's known as the Excelsior list, which is the personal data that an employer has to hand over to the union so they can contact the employees. You'll note a lot of things there that are very personal in nature, and most notably at the bottom, the employee has no opportunity to prevent this from happening. Many employees don't want to be contacted outside the workplace for any reason, let alone a union organizer, and they would have no chance to stop this from happening. So it really does, I think, intrude very strongly into what we would consider to be areas of privacy. Another very significant feature of this bill is that it repeals all the right to work laws in the country. And if you count up those blue states there, you'll get to 27, which is, of course, more than half the country is covered by right to work laws. As we talk about right to work laws, these are the laws that say an employee has a right to work, regardless of whether they pay into the union. In states without right to work laws, employees can be fired if they don't pay into the union. And you'll notice, of course, that Michigan is one of the states that now has a right to work law. One of the things that is new about this bill from the Employee Free Choice Act is the addition of the independent contractor provision. I'm not sure how many of you have followed the ABC test as implemented by California, but it is very dramatic. It effectively, I shouldn't say eliminates, but let's just say it makes it extraordinarily difficult to continue using independent contractors. In California, this was done largely to try and go after the gig economy folks. But in the context of the PRO Act, it's specifically related to the National Labor Relations Act. It uses the same three-factor test, and you'll note that the word "and" in those factors, meaning that you have to satisfy all of those factors if you want to maintain an independent contractor relationship. The bottom line here is that the unions want to convert independent contractors into employees and therefore make them eligible to be organized. If they're independent contractors, they're not eligible to be organized. Another key factor, key provision here is that consistent with eliminating right to work, this also goes after secondary boycotts. Both of those are provisions of the labor law, the Taft-Hartley Act from back in the 40s. And this means that companies with no connection to the labor dispute can be attacked by the union as a pressure tactic to go after the main company. So you see a list down there, that the bullet list of the possible types of companies that could be attacked by a union in a labor dispute with respect to the company A. It really does chill a lot of possible relationships and put at jeopardy a lot of different employers and their ability to continue operations. This is really now, I think, one of the main issues in the union labor arsenal, and that is the question of joint employer. Some of you may remember the Browning-Ferris case that came out of the National Labor Relations Board in 2015. That case stood for the proposition that two employers could be considered joint for National Labor Relations Act purposes if they only had indirect or potential control of the other's employees. This would replace the direct and immediate control standard. If you think about the words indirect and potential control, you can imagine how broad and poorly defined a standard for joint employer that would be. So the PRO Act restores the Browning-Ferris test. In the previous era, the Browning-Ferris case was replaced by regulations from the NLRB, and this would put back in place that Browning-Ferris definition of joint employer. And so as we talk about this, the examples that come up are the franchise industry is certainly at risk here. And you know, we all think about the fast food franchises, but franchises run the gamut in terms of different services. And so all those franchises would be at risk under this type of a joint employer standard. You look at other services that companies use, security, janitorial, construction has a lot of risk here in terms of how that joint employer definition would be used. And so the bottom line we talk about here is that it would make businesses liable for workplaces they don't control and workers they don't employ. We don't think that that's a good way to define joint employer. Another thing it would do is eliminate the use of arbitration agreements. And I know arbitration agreements have gotten a bad rap, but the truth here, the facts are that employees actually do better under arbitration agreements. You'll see the numbers there. They win more often, they win higher amounts, and they get resolution faster. And they don't have to end up paying a lot of the fees that lawyers charge if you go through litigation. It is just simply a better way for an employee to get a resolution from an employer where they have a dispute. This bill would eliminate the use of those arbitration agreements, which then leads to more class action lawsuits, which are generally just a lot more expensive and don't give the employees as much satisfaction. And of course, it jacks up the penalties significantly on employers, but only employers. Note that unions do not have any more risk for penalties here. And you know, let's be honest here, unions are oftentimes a violation of the National Labor Relations Act also. And so the one-sided nature of these penalties is clearly a major problem. And also look there at the bottom, workers don't even have to go through the NLRB under this bill. They could go straight to the courts and get damages far in excess of what they can get today. One final note, and this was mentioned earlier, but in the White House fact sheet that announced the infrastructure package, President Biden referenced the Protecting the Right to Organize Act. And you can see his quote there. I would only say that that quote doesn't necessarily mean that this that the PRO Act will be included in the infrastructure package. It certainly makes it possible, or at least suggests that it could be. If it does get included, our feeling is that it's unlikely to survive the so-called Byrd rule in the Senate, which is used under the reconciliation process. So if the Democrats and the administration want to move the infrastructure package through the reconciliation process and therefore rely only on Democrats to pass it, we don't believe that the PRO Act would survive that Byrd Act requirement. In a nutshell, the Byrd rule says that only those provisions that have an impact on the budget are able to be included in a reconciliation package. And as you may remember from the fight over the minimum wage did not survive that scrutiny. And similarly, we're fairly convinced that the PRO Act would not survive that scrutiny. All of which is to say, we're a long way from figuring out what the final legislative package looks like. And it's unclear whether the PRO Act is going to be part of that, but certainly the president has indicated that he supports it. So we do have to be on guard about how that moves forward. And so we get to the end, and these are ways that you can get involved, or you can just raise your hand and and speak to Chris Mattis here and tell him what you think. So with that, Ron, I'm done with my slides, and let me.
Thank you, Mark. And I just want to backtrack for a moment, because there was a lot of information provided in this presentation, and I think, unlike the first topic, this one, this specific legislation has a much greater chance of passing. It's already passed the House. So Mark, you touched on this in the very beginning of your presentation. I'm going to ask you to repeat, where does this legislation stand in the Senate? As I mentioned, it did pass the House.
That's correct. And in the Senate, it hasn't quite moved yet, or hasn't quite taken off yet. It has, I believe it's 45 co-sponsors. There are 5 Democrats who have not yet gotten on this bill. There are no Republicans on this bill in the Senate. And so it doesn't have as clear a path towards passage as it did in the House. Certainly, as long as there's the filibuster 60-vote requirement, we don't think this can move. If the filibuster goes away, then it's going to become a much more challenging environment. But it's certainly getting attention. The Democrats in the Senate are rallying around it. As you saw the quote from Senator Schumer, they've made a commitment to advance this if they can get enough support.
So Chris Mattis is always used to being in the spotlight, and he does a fantastic job. And we have a great relationship with Senator Gary Peters, who's always very supportive and kind of us, or towards us. Chris, would you like to comment on behalf of the Senator?
Sure. Thanks, Ron. And forgive me, everybody. I wasn't quite sure I was going to speak. So I'm on my phone and a little disheveled. Hopefully you can hear me. Hopefully the angle isn't too weird, but great to see everybody again. And I really appreciate the opportunity to listen to the chamber. I find it really informative, and it's always good to get a full perspective on different issues. And these are hot topics that really are at the forefront of the conversation of what's going on in Congress these days. So I think as far as the PRO Act goes, truth be told, Senator Peters' position pretty simply is that he supports the PRO Act. He is a co-sponsor of the bill in the Senate. And really it comes from a deep-rooted and long-standing belief that the labor movement really is what built the middle class here in America. He is the son of a teacher and a nurse, and then the teacher, and any NEU teacher, so a union teacher and a steward, as well as a son-in-law of a UAW retiree. So, he believes pretty strongly in the right for workers to band together and collectively bargain, whether it's for higher wages or better benefits or safer working conditions. So, I'm certainly happy to kind of break down some of the finer points, but I think here, a lot of the points that Mark brought up, he did a very good job of, I think, kind of breaking down the controversial, for lack of a better term. I hate it. Controversial always feels so like, controversial, but the disagreement points. Yeah, thank you. Yeah, the disagreement points. And I think here, this is a moment where Senator Peters would be disagreeing a lot, at least in particular, secondary strikes, I think are highlighted as something by Senator Peters when I've had conversations with the legislative staff, is something that he thinks are pretty powerful tool for workers to organize for better or potentially for worse based on your perspective. And I also think one thing that he's really, passionate about in the PRO Act in particular is really the measures that would restore fairness and kind of close some loopholes. So that, there are situations now, certainly not all of them, but of course there aren't, there are some bad actors in every sector. And as I've been led to believe or been told, sometimes some employees can be misclassified to kind of make sure that they aren't eligible for overtime pay. They're classified as supervisor or a manager, even though maybe their task isn't all that much different than something like, someone who'd be eligible for overtime, and this would kind of help close some of those loopholes. So,
Chris, I just want to give you one little correction there. I'm not going to debate you on this point.
No, please.
The NLR, the PRO Act's use of the independent contractor term, which is what I think you're going after right there, is specific to the NLRA, not the FLSA. So when you're talking about overtime, you're talking about the FLSA definition of joint employer. In this case, we're talking about joint employers for the purposes of organizing.
So I will say, Mark, you are correct, and those are exactly the folks I'm thinking of. And I will say this is where I was trying to pull into what are some issues I've heard referenced and does it apply to this? And I guess in this particular
joint employer is a very confusing issue. Whenever I speak about it, I have to be very clear about under which law we're talking.
Well, and I'll tell you what, this is why conversations like today are so useful for me, because obviously my legislative counterparts and they're very issue oriented and issue specific, and I'm geographic, so I suffer from I know things a mile wide and an inch deep, right? So
listen, I had your job at one point, not for Senator Peters, but for a different senator, and I do appreciate how you get a lot of stuff thrown at you, and you can be an expert on some things and less.
Regardless of that, Senator Peters does support the PRO Act, and as Mark said, it is something that does have quite a bit of support there in the Democratic caucus, and it'll be interesting to see where things go. For the moment, I know it's not the main topic, but it's certainly at least in the back of everyone's mind. It doesn't seem particularly likely that you'll be seeing the filibuster gotten rid of in its entirety. There are some pretty strong opponents to doing that, even on the Democratic side. And I guess one last thing that I wanted to kind of note was it is really interesting. I think, to the previous point about healthcare benefits, I think this is one issue where, at least to kind of get into the Democratic politics or the Democratic caucus, if you will, the things that we're hearing from the left side. Unions would agree, I think, at least many union members, that they're reluctant, they're skeptical of this idea of too much uniformity in healthcare or just like one health plan, because I think a lot of unions are proud of their ability to really negotiate robust healthcare benefits for their members and show that value of membership. And so I think, it is just an example of how, you can find odd allies and opponents on different issues, and everything's kind of complicated. It is kind of thorny when it comes to healthcare and the complexities of the economy. But anyway, Ron, now I'm just kind of rambling. I'll throw it back to you. I mean, as I said, I'm happy to answer some questions, but Gary Peters does support the PRO Act and is pretty excited about it.
Well, first, we don't obviously not going to go off into discussion on the filibuster, but
please don't. I'm sorry I said anything.
But you brought it up. You brought it up, and I do, because the media likes to talk about Joe Manchin. Joe Manchin. So what about Senator Peters? Where does he stand on the issue?
So I would say Senator Peters, truth be told, I have never heard from Gary, Gary, tomorrow, if they said, you gotta choose, get rid of it all together. My gut in conversations with Gary is that he seems like someone who would be very skeptical and nervous of the idea of just getting rid of it altogether, right? Mm-hmm. Because truth be told, I think there is a lot of value to the Senate being, an entity where it requires more than just bare majority to get compromise and pass legislation. And I think that's something that my boss very much, believes in. He, not to brag, was recently ranked, the most effective U.S. senator, and he did it while he was a member of the minority party. So I think he very much believes in, minority rights and access to the governing and legislating process. He is also super frustrated that, it just does seem like whether it was, it doesn't matter who's in, it can't be a vehicle to just stop all progress, particularly on things where there's an awful lot of agreement. I think sometimes we get into issues and we don't need to list them all today or get into them, where you hear a lot of outcry from a lot of Americans, more than 50%, 60%, 70% to solve a particular issue. And it all kind of sputters out and stalls and dies in the Senate. And there's a lot of things, whether it's infrastructure or other kind of more sticky policy issues, where I think Americans want to see some things done. And so there is some true frustration there when it just becomes like a place where just everything stops and gridlock, and it becomes that negative perception of government that Dennis, painted. But truth be told, at this point, I haven't heard a hard and fast. But Gary traditionally is pretty skeptical of playing too fast and loose and winner take all.
Chris, let me just give you one more point to feedback to Senator Peters to bolster his interest in not getting rid of the filibuster. Something that we're talking about at the chamber is that if the filibuster goes away, you really are looking at a lot of flip-flopping of laws, or at least the potential for that. Every time you get a new political alignment, the new party in power is going to want to undo what the previous party did. And I think, as you've probably heard from the members on this call and other businesses, one thing that businesses universally dislike is uncertainty and instability.
Yes.
And we feel that if the filibuster goes away, it's just going to breed the conditions for that type of instability. And so in addition to, I think, the other points you focused on, which is, requiring more than a majority to pass something, I think we should also look at the consequences of this being a lot of flip-flopping. So
I think that's a good point, and it's exhausting. I mean, we've clearly seen a lot of that. A lot of that exists already, right? Particularly at the executive level. You see a lot of that with the increased needs of executive action, what have you, right?
You don't want to.
But no, I mean, just to kind of say, I agree. I mean, it's exhausting. We don't really get anywhere. We just kind of play this wrecking ball back and forth, and people just get cynical and sad. So anyway, yeah. So it'll be interesting to see where things go. Truth be told, we are really getting kind of American Rescue Plan passed. That was clearly a big priority. And now I think there's a lot of competing interests, but infrastructure does seem to be, obviously, with the White House introducing the American Jobs Plan, I think is what they're calling it, even though it's a large infrastructure bill. That's probably where we're going to go next. And anyway, these will certainly be continuing, kind of hot topics in that conversation. Yeah. So thank you.
Yeah. Mark, you brought up an excellent point, and I appreciate you bringing that up. And Chris, you mentioned that, of course, Gary Peters, our senator, was rated as the most effective legislator in the U.S. Senate. And I'm sure that the filibuster had a part of that, considering that he was a part of the minority party, during that time. So I think I agree with you. I think the filibuster is a very important part of our legislative process. And that's one thing that we, really appreciate about the upper house of our Congress is that, they take a lot of time to think things through, and it's not really the passion or the moment of the day that wins. There's a lot of thoughts that goes into legislation that comes out of the upper house of the U.S. Congress. So we appreciate that, Chris. And of course, please let Senator Peters know that we always appreciate his willingness to participate in the legislative matter, in such an effective way.
Hey, no, sure. Thanks again for letting me be a part of this. Surprise, and thank you so much to the folks from the chamber for being here today. It really is. Speaking for myself as someone who lives here in Southeast Michigan, it's always great to get a national perspective and really speak to folks who are doing that national lobbying, because these are important issues that really impact a lot of communities. So thank you.
So, Chris, you know how it is. If you're on the call, you're going to be called on. So, usually Congresswoman Dingell is represented as well, but I think Brian McMurrin from her office couldn't join us today. But we have a very, very close relationship with Congresswoman Dingell as well, and we appreciate all of our elected officials. I do want to mention that we have larger corporations on the call, so we have really the advantage of having some direct government relations directors from AT&T, Comcast, Republic Services, and others DTE and others that are on the call. And I'm curious if anybody would like to chime in. I'm wondering if any of those larger employers have had conversations about the PRO Act and what that could mean on your corporation and your workforce.
Ron Robert Jones from AT&T. I mean, I'm not aware of any discussions at this point.
Thanks, Robert. Scott, did you want to chime in? Or?
Yeah, thank you, Ron. Same thing with Robert and kind of, I sit in a role kind of similar to Chris in the sense that I'm kind of the local person for a much larger corporation. We take these bills and things very seriously and have a very big interest in them more at a national level through our headquarters. So we have folks at headquarters that work in Washington as well and take a look at those. But as a councilman, I will say, and Ron, you always forget that I sit on city council as well.
Sorry about that.
No, that's all right. It's all right. But as a council person, I do find interest in the healthcare piece, and I will be chatting with our HR people to see how that impacts us or possibly would impact us, because in the end, it's, we're always balancing dimes and pennies. So from a local level.
That's a great point. And that's, Sue Trussel's on the call too with Brownstown Township. And, a lot of times we don't think about the impact that this legislation has on local municipalities, who are also corporations. They're employers in our region. And legislation coming out of the state and of course out of DC are having a major impact on those employers as well. So Scott, thank you so much for bringing that up. And we work very closely with the Downriver Community Conference, who represents 20 of our municipalities in our region, to ensure that they are receiving the necessary resources and advocacy that impacts municipalities in a positive way. Kyle and Barbara, I don't want to put you on the spot, and even Mary Jane with Eastern Michigan University. Any thoughts or has any conversation been taking place at your corporations on the PRO Act?
Hey, Ron, same as Robert. Our HQ staff in Philadelphia and our DC staff are keeping an eye on these things, but they haven't trickled down to the local regional level yet. But that's obviously not to say at all that they aren't issues that we're keeping apprised of. So,
thanks, Kyle. Go ahead, Mary Jane. I see you unmuted. Okay, anybody else? Great. So Mark, did you want to add anything further before we move on?
No, not specifically. I appreciate the comments of Chris, and it's always interesting to have a dialogue about the stuff we work on. But I think the content of the bill pretty much speaks for itself. This is certainly not a balanced bill. And so, I think the chamber's opposition to it has been stated in many places, and it goes all the way to the top. I might note Suzanne Clark has put this on her agenda. So we're very much out there trying to oppose the passage of the PRO Act. I will say, I hope the slides are available. I'm not sure how we get them to you, but I'll send them to you and you can make them available to your members.
I will. Thank you, Mark. If you can forward those to me, that would be fantastic. I do want to mention that, we do want to congratulate our friends at the U.S. Chamber on the recent appointment of Suzanne Clark as their new president and CEO. We are very excited for you and celebrate with you. So congratulations. That's great news. And of course, Tom Donahue is just a legend in the business world, the legislative world, and served as as U.S. Chamber CEO for many, many, many years. And we wish him all the best. And I do want to add also that just so those on our Public Policy Committee know, the U.S. Chamber has just been an absolute amazing partner throughout this ongoing and hopefully ending soon pandemic. But the resources, the advocacy that they have provided with, with Neil Bradley hosting regular calls and providing just great information for us to use to effectively serve our membership in our region has just been absolutely dynamic. So I want to say thank you to Kevin, of course, Katie and Mark, and Ryan and Laura and your entire team. You guys have been absolutely amazing. And our, just our partnership with the U.S. Chamber has just continues to mean more and more, literally like every day to us. So we greatly appreciate you guys for your ongoing support and partnership. Kevin, I want to give you the opportunity if you'd like to add any closing remarks before we close our committee. But again, thank you so much.
Well, thank you, Ron. Thanks for those kind words. And thank you for your partnership. This past year has been a difficult one, and the strength of our federation, the partnership between state and local chambers with the U.S. Chamber, I think we're stronger than ever.
Mm-hmm.
I thought this was a really great way to start the week this morning. Of course, thank you to my colleagues, Mark and Katie, for joining us. And Chris, I'm so glad you were able to join the call, and it's good to see you. And I think I say it's a great way to start the week because we just had a great, healthy discussion on legislation and think that it should be. So thanks again for your partnership. I think Chris and Senator Peters appreciate the comments on, approach to the filibuster, approach to bipartisanship. And of course, Senator Peters was an award recipient from our inaugural Jefferson Hamilton Bipartisanship Award last year. So we certainly appreciate that approach as we enter into these important discussions this year. So thanks again, Ron. It's great to see all of you, and look forward to joining you again soon.
Great. Thanks, Kevin and Chris. We're very proud that Senator Peters is our senator here from the state of Michigan. So thanks again for always being there for us, Chris.
Hey, sure. Thank you.
Great.